Thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I'll answer your questions about the COVID-19 pandemic and give my thoughts on the latest news and science from the week to help you make the right decisions regarding health and safety for you and your family. You can send me your questions about the pandemic, this year's flu season, or anything else related to infectious disease to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Our first question was sent in from Angie, who lives in Brookline. She asks, now that boosters are approved for people who received Moderna and J&J, I understand that the FDA has said that you can get a booster from a different brand than your original shots, and I heard it might even be better. I got Moderna, but I can't find any information about which brand would be the best one for me to get as a booster. Angie, this is actually the #1 question I've been getting since the FDA approved the mix and match approach, which is the use of a different brand as a booster. That approval was based mainly on one study conducted by the NIH, looking at boosters that were different from the original series that the person received and measuring antibody levels in the blood up to 4 weeks later. What they found was that heterologous boosting, meaning using a different brand, worked, and in some cases better than homologous boosting or the same brand at raising antibody levels. This was especially true for J&J recipients who then got Pfizer or Moderna as their booster. But antibody levels at one point in time don't necessarily tell you how protected you are from infection, and higher antibody levels don't always mean you're less likely to get infected or have severe disease. So here's what I recommend for you since you received Moderna, and my advice is the same for people who received Pfizer. First, make sure you actually meet eligibility criteria for the booster. If you're over 65 or you live in a long-term care facility, you should get one. If you meet one of the other eligibility criteria, the CDC says you don't necessarily need one. It's totally up to you. Now, if you did okay with the vaccine you got before, there's no need to overthink it. Just get the same one again. If you're a male under 30, which is the age group most at risk for the teeny tiny risk of myocarditis or heart inflammation that's associated with the Pfizer and Moderna vaccines, think about getting J&J as your booster. For J&J recipients, anyone whose shot was given over 2 months ago should get a booster because the single dose of J&J just isn't as effective as the others. Some people are choosing to get Pfizer or Moderna as their booster because of the higher antibodies in the study, but again, that's entirely up to you. Our next question is from Cassie from Norwell, who asks, when will vaccines for kids under 12 be available? And how will I know if it's safe for my child to get one? Well, Cassie, on Tuesday, the FDA's External Advisory Committee of Experts met and voted in favor of authorization of the Pfizer vaccine for children ages 5 to 11. Now, they had a robust discussion that lasted more than 8 hours, and they focused on the risks of the vaccine compared to the risks of getting COVID and having a bad outcome for COVID in that age group. Now, ultimately, they felt that the benefits probably do outweigh the risks of the vaccine and that it was important to make it available. But they repeatedly acknowledged that we cannot know what the rate of adverse events we will see in that age group will be until we roll out vaccination in large numbers. And the risk of myocarditis, or the inflammation of the heart that has been seen in younger individuals who've had Pfizer or Moderna, could be more or it could be less in that age group. We just don't know. So they emphasize the importance of personal choice and that it should not be mandated by states, for example, to go to school. So to answer your question, this is something you'll have to decide for yourself. The CDC will be meeting to discuss vaccines for this age group on Tuesday and Wednesday next week, and I recommend that anyone who has questions about vaccinating their young children think about watching that meeting. Our last question is from Kevin from Marlborough. I'm disappointed that the Department of Education in Massachusetts extended the mask mandate in schools until January. I'm worried about my child's mental health. When will this end? Kevin, I'm sad that our kids have to wear masks in school too. It's such a difficult issue and it's so polarizing. People feel so strongly that their view is the right one. But under the new mandate, students and staff will continue to wear masks until January unless their school applies to have their mandate lifted by demonstrating 80% vaccination of staff and students in the building. Obviously, that will only work for high schools and maybe some middle schools because younger students won't be considered fully vaccinated until 2 weeks after their second shot, which will be 3 weeks after their first shot. But I hope that some schools will apply and that things will go okay for them and that those schools will forge the way for others to apply. And I hope that in January, the state will release some metrics that aren't necessarily tied to vaccination rates, but are maybe tied to low case counts in the town where the school is, because both vaccination and case counts protect people. And I do think it's important for people to see each other's faces again as soon as possible. That's all the time we have for this week. Please keep on sending your questions to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.